Welcome, everyone, and thank you for joining us today for our Volunteer Voices interview. Um, we're going to go ahead with the interview, and there may be folks who join us during the interview, but even if not, this will be recorded and posted later so that folks can access it and hear what the Fioccos have to share. My name is Rick Power, and I serve with Global Care Force and their support programs, screening and interviewing and assessing volunteers. We're really glad that you're here to join us today for our conversation with Dr. Guy and Dr. Marilynn Prince-Fiocco, who have volunteered with Global Care Force multiple times in different locations. Just a couple of things to get out of the way. We do record these interviews for future use, and there will be a link provided for that. At the end of the presentation, if we have guests live with us, we'll make time for questions and answers. And thank you again for joining us. So, Guy and Marilynn, thank you so much for your service with Global Care Force. You know, we're always honored when people sign up and go on a project with us, but then when they come back again and again, we're even more honored because that shows that we've somehow linked up together in our philosophy and approach to service. And volunteers like you are really the heart and soul of Global Care Force. So, just a quick description of Global Care Force for those who might be new. Its purpose is to transform lives through volunteering by connecting volunteers with organizations serving people in need worldwide. Our volunteers serve with respect to other cultures and faiths. Our goal is to continue to provide primary care teams to areas where healthcare needs remain unmet or access to medical care is unavailable. And Global Care Force is a registered 501c3 nonprofit. We're currently serving in Egypt, Jordan, Ukraine, Gallup, New Mexico, in Rosarito and Tijuana, and in San Francisco. So as we talk with Guy and Marilynn, we'll have some slides to show you, pictures of them. And Guy and Marilynn, anytime you see a picture and it reminds you of a significant experience you had, feel free to speak up and tell us about what's going on in that photograph.
Well, the photo on the right is from El Paso, and we did 2 tours in El Paso, and one of the best moments was meeting the young children who had come across the border after a long and very dangerous trek from whatever country they were coming from. And as you can see, the smile on the little girl, even though she had gone through one of the worst times in her life, was still able to smile and be appreciative of what we could do for them.
Mm.
And that extends in those experiences. Of course, we're always seeing these children in conjunction with the parents and recognizing that the thing that brings a smile to the parents' face is seeing their children look happy, even if just for a short period, because the experience of those children at this point is so different from what our own children did and our grandchildren now. And for parents experiencing these crises in their lives and realizing how different it is, but to make them all appreciate our care, the thing that makes the most difference, I think, for parents is to see their children cared for.
Absolutely. That's really a great picture. As I've been meeting Guy and Marilynn and learning a little bit about them, I've learned that they are retired physicians living in Wilmington, North Carolina. And Marilynn was involved in pulmonary medicine, and Guy is a rheumatologist. And I assume you probably did some volunteer work even while you were still in your careers, but we're so grateful that in retirement you've made your time and expertise available for these mission projects.
Yes, we have done that throughout our careers. We were in places where there was a local charity clinic where we, continued that care, and also in some other non-medical experiences in working with refugees and with the Literacy Council in terms of teaching English, where we're always humbled by how difficult it is to learn a new language and live in a new place. So we appreciate the courage of the refugees we meet in these different locations in their efforts to get engaged in their communities.
Yes.
One of the first things we did while we were still in training was to go and work in a refugee camp in Thailand for the Cambodians. It was only weeks after we got married that we headed off to Thailand to work there. It was a UNHCR area that hosted the Cambodians, and we made friends there that we still communicate with.
Oh, that's wonderful.
The refugees who actually were able to come over, and we learned a lot about their culture, and it's amazing that we still have that connection.
There's so many fine organizations that are serving around the world, and you've served with some of those. What made you decide to volunteer with Global Care Force?
Global Care Force is one of the few organizations that allows volunteers like us to be in a shorter term setting. We are, now 70 and above, and when we retired, which was actually just before COVID, we had expected to travel and volunteer and be in perhaps a Doctors Without Borders kind of setting, only to learn that that they're really not looking for older specialists. They benefit most from younger people with a career, especially involved in trauma. And Global Care Force has recognized the fact that physicians, even in various specialties, share the common background of initial training, the importance of histories and physicals and maintaining that general care. So we've had the opportunity to go back to our original settings and realize, even though we have done a lot of specialists, that it's primary care as well as just empathetic care, which matters to the populations we serve.
Yes.
We really first met Global Care Force when they were COVID Care Force. And so we had been volunteering on a Navajo reservation. And we have a special bond to the Navajo reservation because that's where Marilynn and I met. When we were both in different medical schools, but spending a rotation on the Navajo reservation. So one of the first things we did when we retired was to volunteer at an Indian Health Service hospital on the Navajo reservation. And while we were there, we met some of the volunteers of COVID Care Force. And that's how we learned about COVID Care Force, which then transitioned to Global Care Force. And we've just been impressed with the organization since the beginning.
We met Dr. Morse out on the Navajo reservation, in fact, so we had his personal endorsement of the ways that we would be able to serve.
So you served with COVID Care Force on the Navajo reservation. You mentioned that you've been to El Paso, and I know you just returned from Jordan with the team there. So you've had a great sampling of the places where Global Care Force serves. Any other teams that you've been on? Did you also go to?
we went to Ukraine 3 times, and of the different experiences, that probably is the one that still is most meaningful for us because of the way that organization is structured and our ability to go back after the first time, to go 2 more times and have the same translators and the camaraderie that develops in that group. And then the other aspect there is the unique nature of the population we serve, but the ability to learn more about their shared culture. One difference between there and this experience in Jordan, where there were people from different cultures, we didn't have as much knowledge of whom we were serving in terms of their own experience. In Ukraine, the whole population has suffered the same way, and we meet them and begin to understand them a little bit better.
Tell us about this team pictured here.
This was recently in Jordan. And every time we volunteered, we meet up with a different team, but it's only a matter of a day or so before we become a cohesive group that really works together and enjoy each other's company and seem to get the same benefits out of what we're doing for the population we're serving.
Mm-hmm.
In that team picture on the far left, Roxanne, who has been the global director, and the nurse who we met, I guess, with our first Ukraine trip, and she is an amazing organizer and works also directly as the pharmacist on these groups. So we're very dependent on her. She just does an awesome job at organizing the expeditions. Then there's myself and Guy. And then in this most recent team, Dr. Frank DiPolisi, who is a psychologist, offered a really significant benefit to the way that we were able to help by being able to meet some of the patients who had the highest levels of anxiety and depression, which was the main aspect of care. And then Anne, the triage nurse, very experienced in that, who even on our busiest days saw everybody and did an amazing job in triaging.
Thank you. I know that the team includes more people than are in that picture. And in Ukraine, we often have multiple translators, drivers, maybe even Ukrainian medical personnel. And I'm sure that experience of working with the expanded team, people who are actually from the country where you're serving, that must be very meaningful to team up with them.
Oh, it definitely is. I mean, it's been the only place that we've been with Global Care Force that we have basically the same team of Ukrainians each time we go. And Dr. Lev, the Ukrainian physician, is incredible. The translators are always the same, and we tend to use the same translator for each individual. So you really get a tight bond with your translator. We eat, sleep, drink, do everything together. So it really is one big team, and not necessarily an American team and a Ukrainian team. It's one Global Care Force team.
Mm-hmm. Right, especially in Ukraine, with the fact that we went back, a couple of times, so we already knew them, and their level of energy and enthusiasm, and through those 3 times, increasing professional capacity as well, really makes a difference in how we serve. Those are interesting pictures here. the one with Guy, caring for, as a rheumatologist, he was able to exercise some of his specialty with actually doing injections. I think there was one in a previous picture where I was trying to look in the ear of somebody, and right, and that was an interesting problem that, in Jordan, because so many of the women wear burqas, it's a real challenge to do an adequate exam, to listen to lungs and listen to hearts and still maintain,
look in the ears.
right, and maintain the important cultural modesty and respect.
You must have met so many amazing people on these projects. Could you choose one or maybe two that stand out to you as really memorable, kind of transformative encounters you've had with people either on your team or patients that you treated?
Well, we've met so many patients, but just one outstanding individual part of the team, who I worked with several times in Ukraine, my translator, who has become an international friend for me, Svetlana, who is, I think, now the head of the Nazarene Church in some way in the Ukraine area, but such a kind and professional helper and wonderful person.
And my translator in Ukraine is a young man who's in physical therapy school. And he does all his work online, and yet he has volunteered every time we've gone to Ukraine and has worked with me. So we've developed a very strong bond and communicate after we've left Ukraine.
In terms of the patients, just as a whole, in each of the different locations, we see more women than men. In Ukraine, that recognizes the fact that so many of the men, unless they're elderly, had been called to the front. So caring for women with their needs was often the recognition that women have become stronger and more able and independent, and yet if you actually talk to them a little bit further, nobody is sleeping very well. Blood pressures are extremely high because of the anxiety as well as the lack of medication.
Looking at the picture of me about to inject that knee, that's one thing I have an advantage, I think, over the rest of the team, is that I get instant gratification because after the injection, it feels so much better. And there's one woman in Ukraine who was this elderly woman who hobbled in. She actually rode her bike to the clinic, and she had terrible arthritis, and I was able to inject her knees. And she took a few steps and realized how much better it felt and came over and gave me a kiss and then turned around and said, "But don't tell your wife."
Great memories.
Tragic stories of women. I remember one woman when we were as close as we get to the front lines near Mykolaiv in Ukraine, whose back pain had increased, her low back pain, and she was a woman, I think, in her 60s, and we asked if she had been doing anything that made her back pain worse, and the answer was that she had been digging graves for the Ukrainian soldiers.
Yeah, and that's all you can do is admire and respect and stand in awe of people going through experiences like that, and yet finding the courage to get up every day and care for their families and keep going.
In Jordan, just again, we don't know as much about exactly where people are living, but I remember one woman, and I asked who also was having, back pain and fatigue. I asked her about her sleep. Did she have a bed? Did she have a pillow? And she said, "You asked me if I have a bed and have a pillow? I'm a refugee."
Mm.
The answer was no.
Yeah, yeah. For those who might be thinking of volunteering with Global Care Force, could you describe, if there is such a thing, a typical day? What's the routine from morning till evening?
Yeah, it was a little different in Ukraine than it was recently in Jordan, in that in Ukraine, we stayed at hotels and the whole team stayed together. So we would get up in the morning and have breakfast together. Then we would load up the vans and go to the clinic that we were assigned for that day. We would take a break and all have lunch together. And then we would drive back to the hotel at night and have dinner again all together. So really there was one cohesive group that did everything together. And that's how you become um, so part of the team. You really make friends that you would never realize that would happen on a volunteer trip like this.
Mm-hmm.
The clinics in each place, well, in Ukraine, we use several different facilities. Some have been abandoned schools, one of which had bullet holes, in it. So, some were churches that opened their doors to set up a clinic, and we would have to decide each time, where each of the providers could see patients, trying to have enough space, and with Roxanne set up all the pharmacies, but it would often be just the peeking out into the hallway where patients usually are and seeing just a hallway full of patients, each waiting their turn and trying to recognize that our no matter how many patients there were, we were planning to see them all and wanted to see them all, with adequate time. But that one, for example, picture in the middle there is just typical of seeing a hallway full of people who just wait.
Yeah.
So you never really know how many you're going to see, and whatever word of mouth or publicity brings them in, they're often sitting there, some of them waiting when we arrive in the morning and set up, and then we just there. So it's fatiguing, but interesting, challenging the whole day.
You've mentioned a couple of things that might raise questions in people's mind about safety. And I know that Global Care Force puts a very high value on the safety of our volunteers. But you are going into situations that have been affected by war, large numbers of refugees. Have you always felt safe, or anything you'd like to share on that topic?
I think we've always felt safe. When we're in Ukraine, the air raid sirens were going off all the time. And even though the hotels say that when you hear the sirens, you should go seek shelter, we were able to get an app that showed where the incoming missiles and drones were going to be. So we never really felt in danger. And the same thing in Jordan, which we weren't expecting because things weren't really that heated when we left. But as soon as we arrived, is when the drones and the missiles were flying between Israel and Jordan. And we could actually see them being shot down by the Jordanian army, not that far from the dormitory we were staying. And yet we all felt comfortable to go out on the balcony and watch this fireworks show, realizing that they would have told us if we were in danger.
Right.
I think our friends and families at home were more worried about our safety than we were there, realizing that we're in the middle of a situation where the entire population is experiencing the same risk that we are.
Yes.
So just the power of statistics say that we'll, probably be okay in Ukraine. I think they make a big effort to
Yeah.
um, to make sure that we're not in areas that seem to be active conflict. The problem with current warfare is that you can't really make that assumption anymore because the drone warfare has changed the fact that there can be random
Hmm.
events anywhere that you are, but people go about their life as they can. And I think one um, thing in Ukraine especially was the recognition that the children again are gone almost, or especially early on. A lot of them, have come back, but there should be children in schools, and we're running a clinic in this school with algebraic equations on a poster on the wall and saying, this is not a third world country. This is like where I have lived, and there are no children here.
Yeah. Thank you. As we move toward the end of this interview, I wanted to ask you what advice you would give to someone interested in volunteering with Global Care Force.
Mostly go for it.
Yeah.
If you have
you think it's really an opportunity of a lifetime.
Mm-hmm. Yeah, and for those who are watching and interested, you can go to our website. You can scan the QR code that will come up here in just a moment. You can email us. There's a number of ways to contact Global Care Force and let us know of your interest in volunteering in one of the locations where we serve.
And as a side note, I would say on each of the trips we've been on, there's been at least 2 days of the 2 weeks that we were able to do some sightseeing in the country, which made a huge difference. Here we were in a country we had never been to before, and they took the time to take us down to Kyiv and show us all the sights in the capital city. In Jordan, we were able to go to Petra and the Dead Sea, which are opportunities I don't know if we would have had otherwise. So there's a hidden benefit to the volunteering with the organization.
Good. Well, I
the
want to thank.
host, the local hosts that enable that and are so knowledgeable have made those amazing experiences because, of course, you could go on tours, but to do that with people from the country with their current experience, to take the time to do that is special.
Rick, I just want to acknowledge that we've had John and one other person just joined us, and I want to make sure we can give some opportunity if they have any questions. I know that they've they missed some of the conversation, but maybe we should give them an opportunity if they have questions.
Yeah. Any questions from those who are on the call right now? Go ahead, John.
I'm not sure my audio is on. I'm having some technical issues, but
we can hear you.
Oh, you can? Okay, yeah. Yeah, and I can do this offline as well. But yeah, obviously, we're looking forward to getting back to Ukraine. I know that there's much less pressure at the southern border. I had talked to Elizabeth Vargas a couple of years ago because it's still kind of a goal to do some work down at the border. I'm pretty sure you guys are kind of cooling off from that particular site, the El Paso rotation for now. But any plans for what you foresee in the future? I know a lot is unknowable probably, but.
Yeah, you're exactly right. The situation on the border has changed so much that we're kind of paused with that work. But if you want to email us, there are people in the Global Care Force office who can speak more directly to that. Any questions for Guy and Marilynn regarding their experience with Global Care Force?
No, I mean, I've worked with many organizations, and you guys sound like an awesome one to work with. And yeah, their stories are very inspiring for everybody. So on the shoulders of giants for sure. So thanks so much for the opportunity.
Great. Thanks for tuning in.
Mm-hmm.
We also hope that the border effort will at some point be revived. If so, we would be interested in returning to that as well.
Sure. Okay. Well, as a follow-up to this interview, we will provide a link to the recording and volunteer application, email contact information for any who want to follow up. And please help us spread the word. Follow us on social media. And we hope you'll have an experience like Guy and Marilynn have had. Once again, Guy and Marilynn, thank you so much for your deep engagement with Global Care Force. And it's been a pleasure to talk to you today.
Thank you, Rick. And John, good luck to you in thinking about the future opportunities here.
Yeah, thanks so much. Yeah.
Thank you, everyone. Have a great day.
Okay.
You too.
Bye-bye.
Bye.